Okay, it's 3 o'clock and I think we're ready to go, everyone. Nadine, Erica, I'll turn it over to you.
Thank you, Bobby. Oh, I want to welcome everyone and thank you again for joining us today for our last, but certainly not least, CVAC meeting. And while this is our last meeting, I want to say that it's certainly not the end of our work, and it's not the end of our statewide vaccination efforts that are, as always, grounded in the values of safety, equity, and transparency. And we know that we have a lot more work to do as we continue to strive for an equitable rollout of the COVID-19 vaccine to ensure that all communities have the benefit of protection. And particularly as we're looking forward to our vaccine rollout among youth and children. And as we begin to think about the move forward in developing our road for recovery in addressing the direct and indirect impacts of the pandemic on our communities. And so we're incredibly grateful to all of you for your participation, your partnership, your wisdom in this process. For today's meeting, we're going to, as always, begin with the basic ground rules and public comment. Then we'll take a moment to review some reflections. Dr. Pan and myself will share some reflections from this process, what we've accomplished, how far we've come. We're going to hear from our communications team again about our update, about our outreach and engagement, and hear a little bit about lessons learned about reaching vulnerable communities. And we're going to hear from you. We've asked for your reflections about this process, lessons learned, what went well, what didn't necessarily go so well. And we're so grateful that so many people responded with very, very thoughtful comments. And so we will have several representatives who are sharing the comments out because that's incredibly important and valuable to this process. And then finally, we're going to hear from Dr. Pan about what lies ahead as we're moving forward in California's vaccination efforts. And with that, I will turn it over to Bobby Wunsch to go through committee ground rules one more time and public comment.
Great. Thank you, Dr. Burke-Harris. And welcome, everyone, one last time for the meeting process in case anyone is new to our meeting, either in the public or watching on our live YouTube link. We'd like all of the members to be on camera and keep their microphones on mute until ready to speak. We will continue to use the hand raise icon through this meeting to make comments or ask questions. As you all know, we've had two incredible ASL interpreters for every meeting. Vicki Kennedy and Katie Sales have done a wonderful job, and they've been with us since the beginning, and we're so appreciative of their very hard work that they've done on behalf of all of you. We have our two public phone-in lines, listen only, one in English and one in Spanish. And of course, the meeting is being live streamed on YouTube. If anyone has any technical difficulties during the meeting, please feel free to ask your technical question in the chat, and we'll do our best to answer it during the meeting. So thank you for that. I'd like to report on our public comment for this meeting. We only had one public comment since our last meeting on May 12th. It happens to have come from my dear friend and colleague, Jim Mangia, in Los Angeles at the St. John's Well Child Center, expressing his concern about California losing momentum in the vaccine effort and urging us today at our meeting to continue discussions about lessons learned through the pandemic and how to establish health equity in our healthcare delivery system and in our communities. In addition to that, I'd just like to reflect and remind both our committee and thank the members of the public for all of their comments the 7 months that we have been meeting. We have read, we have summarized almost 1,200 pages of public comment with comments from a little more than 3,700 members of the public. The comments have been thoughtful, they've been important to the proceedings, and I know the members of the Community Vaccine Advisory Committee wish to thank the public who've expressed their opinions throughout this process. Thank you. Back
All
to you.
right.
There you go.
Yes. So I'll jump in with some reflections and opening comments, and I'll get started, and then I'll hand it over to my co-chair, Dr. Pond. And you know, I have a bunch of notes here, and I will refer to them because I spent a lot of time. We spent a lot of time reading all of the feedback that you shared with us. It was very, very powerful and insightful, very helpful. But I'm going to go a little bit off my notes right now because I want to speak directly to everyone who's participated in this process and to our public as well. One of the things I found myself saying over and over again in this pandemic, whether it's to my kids, whether it's to healthcare providers, whether it's to parents who are trying to figure out how to navigate the situation, is this is hard. If it feels hard, it's because it is hard. This is a once in 100 years pandemic. And when this CVAC came together, it was to take on a task that was really, really, really hard. And so I want to start by thanking our CVAC members, each and every one of you, for your time, your dedication, your commitment, your persistence, your patience, your expertise. We came together to do something that was incredibly difficult. And if there's one thing that I feel good about as we are today in our final meeting, is just the extraordinary way in which everyone showed up. And everyone contributed in a way that I will say, I don't know if it's right for me to say this, but is sometimes uncommon in politics, right? Or in government. I don't know. Maybe that's, but it's really, it really has been extraordinary. And the thing that struck me as I was reading all of the feedback that we got from you guys was the power of the collective. The power of the collective, of the beautiful and diverse representative voices of the communities across California. And together, we made this process better. We took what was a very difficult and daunting and sometimes frustrating task. And I believe, and I read in the comments reflected from many of you, a shared sentiment that that process was better because of the way that we all came together, of our discussions, because of your advocacy, because of the way that you all represented your communities. And that is something that I'm incredibly grateful to you all for, and for sticking with it through sometimes moments when it felt unclear, and sometimes when it was just frankly frustrating. And we weren't able to do everything that you all recommended, but we heard it and we received it, and we are taking all of these things and hopefully being able to inform our systems and processes as a state, as a government, as we move forward. I also want to thank the tireless efforts of our support teams who have done this. A lot of the comments were focused on the information that was presented. It was thoughtful, it was prepared, it was well organized. Thank you for that feedback. We're very grateful to hear it, but I want to lift that up and put that out to our extraordinary teams at the California Department of Public Health, the Office of the Surgeon General. And I'm going to say it right now. I'm going to say it again at the end, but I'm going to say it right now. Bobby Wunsch, if there was a standing ovation that someone could do in a meeting, I just want to lift up and shout out Bobby for her extraordinary and heroic work, her responsiveness, her thoughtfulness, and just her general good humor as we went through all of this together. The definition of a public health emergency is that it overwhelms our public health infrastructure. That's the definition of a public health emergency. And our teams have been working through some extraordinary times, really with tremendous dedication. And I want to say a huge thank you to our teams. I want to say a huge thank you to my co-chair, Dr. Erica Pan, our state epidemiologist, again, who just approached all of the work with tireless energy, humility, grace, thoughtfulness, and brilliance. Since we started this process, California has administered 40,531,398 doses of COVID-19 vaccine. That's extraordinary. We have centered this work again in our values of safety, equity, and transparency. We didn't always hit the mark or achieve our goals when it came to every aspect of those values, but it was clear, and it was clear from your feedback, that they were the guiding North Star as we moved through this process. And in moments of uncertainty, it helped us to orient and understand where we were trying to go, even if there were incredible obstacles in the way of getting there. California took the incredibly bold step of allocating 40% of our vaccines to our most disadvantaged communities, exceeding any other state to my knowledge. And although we have a lot more work to do on many different fronts, we tackled language barriers. We tackled, drove for solutions to ensuring that our Californians with disabilities were appropriately served. We recognize the challenges facing our farm workers, facing our meat and poultry processors, facing our childcare workers, facing our seniors, facing those in residential facilities, facing our California businesses, facing our educators. All of these voices, and of course you guys were here, so many more were represented in this process. And one of the things that we heard over and over again, which I'm really heartened by, was that the inclusiveness, the broad voices, the diverse voices that were included in this process were an incredible asset. At the same time, that was counterbalanced by the size of the committee, right? And our ability to be able to do the very difficult job of recognizing and holding a variety of interests as we were trying to move forward. And what I was heartened and humbled by was the way in which committee members did that with such grace. The advocating and appropriately representing the needs of your respective constituencies, and at the same time holding that picture and the benefit to the whole. That was done really beautifully, and I really want to commend our committee members in doing that. Again, we didn't get to everything, but we did what we did with a spirit of collaboration. We recognized intersectionality. We recognized the strength of the whole and our broad community voices. The last couple of things that I will say is that one thing that we heard over and over again from you all in your comments that reinforced a strong value, lesson, and learning for us is the need to embed many of the learnings that we have experienced and gotten from this process, from the CVAC body, into our systems and our processes in the Department of Public Health and for the state of California overall. And I will speak specifically the Department of Public Health, the Office of the Surgeon General, and California government overall. And for that, that's our intention. That's Dr. Pond can say a little bit more about that, but we intend to carry these lessons forward, and we're really grateful for your time and thoughtfulness and expertise in helping to bring that to the state of California. We are grateful for your endurance. We're grateful for your persistence. We're grateful to the many members of the public who not only tuned in to these meetings, but also shared their public comments to enrich and inform this process. And this is not the end. So with that, I will say thank you all very, very much. My most sincere thanks. And I'll turn it over to my esteemed co-chair, Dr. Erica Pond.
Thank you so much, Nadine. And I just want to echo so many of the comments that Nadine just made. I want to just, again, acknowledge that this is a once in a century crisis, essentially. And as much as, you know, I'm someone who has done other emergency preparedness in the past, and so we want to do so much about putting together systems to make those emergencies go well. It really all boils down ultimately to the people and the relationships. So I'm incredibly grateful for all of you and this this committee for the relationships we've just begun, actually, right? It's only been a few months, and as Nadine said, I think we hope to continue to build upon this moving forward. And as also mentioned, every single one of us and every single one of you has a whole team behind you and a whole sort of set of constituents and stakeholders and your own communities that, you know, we all did this together. We got here together. So we want to thank all of you. I'm going to be doing a lot of reflections kind of throughout the course of today. But, you know, it is really just exciting and wonderful to be with all of you today, to be in our Beyond the Blueprint moment and think about all the ongoing improvements we've gotten here to this moment in California post reopening, and returning to some of the things we miss and love, all due to vaccinations, actually. And it's been really interesting over the last, especially week and a half since June 15th, a lot of moments of reflections in many settings. No doubt we've learned so much over the last year and a half. And, you know, never was it easy, and never were you able to completely anticipate anything that was coming around the corner for any of us, I think, over the last year and a half. So I'm really looking forward to this afternoon to reflect and learn more from all of you today. I've really appreciated reading the very thoughtful comments, as mentioned, and I'll comment more on those later as well. But and think together about not only our successes, but where we need to continue to get better and move forward. And I do want to make sure we have a lot of time for your reflections. So I'm going to kind of launch in. Let's go to the next slide. Just a few kind of highlights to touch on as far as data and reflections again. So, we do still have serious disparities in our diverse communities here in California. But actually, compared to a year ago, our case rates and death rates have improved thanks to partnerships across the state and with many of you. We actually had, unfortunately, a double-digit death rate disparity in African Americans now, and it's now reduced to a single digit. It's not acceptable, but it is improved. The Latino death rate disparity has decreased from over 40% down to 21%. So we have moved the dial. And this cumulative data that you can see on this slide and on our dashboard for equity reflects overall disparities since the pandemic began last January in 2020. But again, these are still unacceptable, and we need to work together to continue to drive these inequities down. I also just want to shout out to, again, our work together, and that the work here in California has been recognized by a lot of other national entities. And just hot off the press, as I learned today, there's a publication in the American Journal of Public Health about our work using health equity early on to really tie that to our reopening and use that to reopen safely and equitably. And then we worked with all of you to think about vaccines being distributed equitably. Next slide. So as Nadine mentioned, we've administered more doses than people in California at this point, over 40.5 million doses administered. And we have reached that benchmark that's been looked at across the board of over 70% of adults have received at least one dose. We're ahead of many, many states on this. You can also see on this particular slide that our over 65-year-old group is at almost 80% with at least one dose. And actually, this is just our state administered doses. So there's a few of those that are federally administered that are not included in these numbers. So some of the national numbers you'll see on the CDC website, for example, are even higher. But again, we really need to continue to work with an equity lens. Next slide. So while our overall numbers look great, we still only have a little bit less than half of our Latinos, 46.6% of Latinos, about 50% of our American Indian Alaskan Natives, and 44.5% of Blacks are vaccinated to date. And that's just with at least one dose. So we want to get all of our communities, as many as possible, fully vaccinated. I think another note and theme that has come up both throughout the pandemic and through many of your comments, and certainly we are reflecting and working hard moving forward on data. There are about 3 million doses in here that are currently classified as either other or unknown. And we do have concerns about that data quality and misclassification. Some of those misclassifications we've seen when we talk to some of our partners on the ground. Sometimes those are multi-race that are being classified as other unknown. Many actually Latinos are potentially sometimes getting put into these other buckets. So we're continuing to work with partners and people that do that data entry to improve our data quality, to continue to look at this. I think the other thing that has been highlighted as far as data and infrastructures is how decentralized everything is in our health systems, in our public health infrastructure, and in the resources provided to collect data well, to have the IT and informatics and epidemiology infrastructure to really improve that. And that is something we're absolutely looking forward to improving moving forward. Next slide. I think the other area where, so one way, of course, of looking at it is by race ethnicity. The other way is, as you all know, we've been talking a lot in this group about our Healthy Places Index and how we transform that into a vaccine equity metric. And this is sort of a nice slide, and you can pull this up on our website to see ongoing trends as well. But this is kind of a nice illustration over time. We still only have 56% of our Healthy Places Index or vaccine equity metric Q1 that are at least partially vaccinated. And we want to get that number up to 70% and close that gap. But you can see here the trends over time. And in March, where we were able to close the gap again because we disproportionately allocated doses to, again, 40% in Q1. And then you can see that the gap opened again when eligibility opened to everyone, and those who had the most resources, who could mobilize and take the time off to do it and drive to where they needed to go and look up where to go and use technology, got vaccinated. But then again, you can see sort of since that, we have been able to not only close that gap to some extent in early May, but in the last several weeks, we've actually really improved the proportion of people in quartile 1 and they've actually surpassed the proportion of those in Q4 over time that are getting vaccinated. So we're making huge strides, and we're going to talk a lot more about that moving forward. Next slide. And I think one thing actually just to highlight, because there are still some incentives to go on this that we do think has made a difference, is our vaccine incentives. So hopefully many of you have heard about all of these. We still have, I think we've allocated at least 1.2 million of the $50 incentive cards, but we still have another 800,000 of those next people that sign up to get vaccinated can still earn a $50 incentive card. We have one more big Dream Vacation giveaway on July 1st for everyone who's entered in our California Immunization Registry. So anyone who's in there who's been vaccinated can win one of these Dream Vacations. So what are some of the results? This is a common question that's coming up. This incentive program has definitely, we have still been achieving on average over 100,000 vaccinations a day, and certainly nowhere near our peak, and we were seeing some slowing before this incentives were rolled out at the end of May. But we've also really importantly seen some improvements in, again, quartile 1. And as you can see on this slide here, 29% of all doses have been administered by the end of last week. And so a sustained increase in quartile 1 over the last 4 weeks. And now, again, we've outpaced other quartiles in our weekly vaccination rates. So we're continuing to assess the effectiveness of this program, but early data, and we're doing some post-vaccine surveys as well to see if incentives are a contributing factor for individuals to get vaccinated and seeing how to do this. And we ask that you amplify this, because I think we've also heard anecdotally that many people don't know about this incentive. And again, we still have, at a minimum, the $50 incentives, and the Dream Vacations are still to be given away. So I think that is a good point to turn it over to my colleagues who can talk more about our outreach and engagement. Next slide. So I'll turn over to Sonia Harris and talk more about what we are doing to continue to close this gap.
Erica, before we turn this over to Sonia, maybe we could take a comment or two from the CVEC members. If anybody has a question for Erica at this point, Erica's going to speak again at the end of the meeting about what's ahead. But if anyone, any of the members have a comment they'd like to make or a question for Erica, we probably have time for a couple. Just raise that electronic yellow hand and we'll call on you. Okay, Erica, you did a great job. No comments. So we'll wait till a little later to get on you. So now, without further ado, let's hear from Sonia Harris from CVPH. Sonia?
Thank you, Bobby. And following in the good example that both Dr. Burke-Harris and Dr. Pond set in really helping us take a moment to start today with gratitude. That's certainly something else, something I would also like to express the first time I've had a chance to come before you all to talk about the team's work that's collectively working on community engagement, especially to reach those that need us the most. So many of you have, served as our counselors. So thank you so much for taking the one-on-one time, with members of our team, to provide your wisdom, your counsel, to tell us what's going on the ground. So many of you have been our true partner, working alongside us, but really doing the hardest work to reach those communities. And last, but certainly not least, also very grateful for your sacrifices. I think it's clear that the pandemic didn't rest over the many, many months that we've seen. And in the spirit of our good governor, you all certainly met the moment and even beyond, especially answering this call to public service. So just wanted to start with that piece of gratitude as well. So diving right in, what we've done is deploy a fully integrated public education, community outreach, and direct appointment assistance campaign all in one and managed to build that, in the last 6 months. And so, at Bobby's request, we've cataloged a little bit of that and want to kind of walk you through. So if we start on the next slide here will ground you in the entire campaign all along the way has been data driven and really focused on equity. As this team, as well as others, have really prioritized that first quartile within our vaccine equity metric, or the Healthy Places Index, as our North Star to guide our decisions. So here on the right, you can see just a little snapshot, and I notice it's probably a little bit blurry, but it's from our CORD tool, our Outreach Rapid Deployment tool, which helps our teams really understand a few different pieces of information, but mostly vaccination rates in geography form. And so you can see here, there's a couple different colors that indicate, what rate at which those communities are vaccinated. This particular snapshot's from Fresno. And if you can see the little green dots, it also shows us, where some of the clinics are relative to this particular place. And so it really has helped our campaign educate and connect communities that may need access to vaccination sites. And as we look at the operations side of the house and all that the Department of Public Health team has done to really increase access, as Dr. Burke-Harris mentioned, really address some of the barriers that we saw early on in vaccination. This helps us, again, help connect community more effectively, more efficiently, and also has helped us with some planning. We're very fortunate that our local health jurisdictions have begun to use this, as well as some other tools within CDPH, really to inform, again, how we reach those that need us the most. Moving on to the next slide. We've also supported trusted messengers along the way. And so early on in the pandemic, the state was able to create a network of CBOs through our colleagues at the Department of Social Services, as well as Labor and Workforce Development Agency, in a public-private partnership with Public Health Institute and the Center at Sierra Health Foundation. So through that work, we've been able to create a network of nearly 500, growing every day, it feels like, of community-based organizations that serve as our trusted messengers, the ones that we know will really have the conversations to compel people on their personal journey, right? Getting a vaccine is no easy decision for so many of our families, and making sure that they've got someone that looks like them, really sharing some of their own personal stories. In addition to that public-private partnership, along the way, we were able to launch a couple other places where we could collaborate. Certainly, again, with our local health jurisdiction partners, they have several hundred community-based organizations that are also funded through their own communities and networks and systems that exist, rounding us out with our Get Out the Vaccine effort under the Government Operations Agency, which is a very highly targeted door-knocking campaign, phone banking campaign with 70 CBOs. We anticipate that the number is somewhere closer to 1,000 community-based organizations spread all across California doing this important work. Next slide, please. So just a quick summary of the state's CBO network, the ones that I mentioned across Department of Social Services and Labor and Workforce Development Agency. This slide should look familiar. Our team member, Emilio Vaca, has shared this in the past. And so just a quick update for you. We've been able to make contact with over 2 million households through our phone banking program, and over 200,000 going door to door in specific communities, which has resulted in nearly 500,000, or just over 500,000 appointment referrals, and 180 appointments that were actually facilitated. Next slide, please. And in order to coordinate all of those 1,000 CBOs, it's been a wonderful pleasure to be the entity that gets to help coordinate and create collaborative spaces. So in early May, we launched an initiative called our Collective Impact Tables, which was really to help coordination across the ground with a handful of key goals for these groups. Really, again, being data-driven and focused on equity, really being able to understand the data, how communities are reacting and taking up the vaccine, and then, of course, prioritizing resources. As we look at this important work, peer-to-peer engagement takes energy and effort, and of course resources, and then really creating a plan across multiple stakeholders to make sure that on a week-by-week basis, we're really making progress. So over the course of the 7 weeks that we've been able to host these tables throughout California, virtually throughout California, but broken up in different regions, based on our statewide network. We've been able to host over 1,000 participants through these, again, really signifying the collective impact. But I think the willingness of different partners over the last 6 months to come together and work to achieve a common goal. Next slide. So outreach would not be as effective without the communications and media component. So in that full integration space, we've been able to do quite a bit, since the launch of the Vaccinate All 58 campaign in December. We were able to bring on board a vendor really to help us get smart and execute some formative research, but from that build out a campaign that really spoke to where Californians are and trying to meet them and again, their personal journey on getting the vaccine. And so in March, we were able to launch our Let's Get Community campaign. You remember Martha, Dr. Dominguez has been in front of you sharing so many of the fun goodies, often fun pictures and PSAs that we've been able to deploy that have really moved the needle to get us into some communities with the introduction and approval of vaccinations for 12 and over. We also were able to launch a second campaign in May, really focused around families and answering families' questions around what their children should experience, what they should experience, and why it's important for them to get vaccinated as well. And as Dr. Pond mentioned, we had a pretty big initiative roll out just a few weeks ago and are definitely excited about the success, but we had to tell Californians about it. So we also launched in May, later in May, a campaign to inform Californians around a state incentive program. And from all of those, so many materials, campaign materials in 18 languages that, really were tools for our partners and stakeholders. Next slide, please. In addition to paid media, earned media has been at the heart of our strategy from the beginning, really leveraging all of our trusted messengers, particularly in the ethnic media community. It's also really offered us a great feedback loop. Again, the work coming back in from our CBOs, really understanding how people are feeling, what misinformation they might be getting that we need to address, so on and so forth. And being able to execute, especially with our Spanish media partners, some really wonderful programmatic elements like a phone bank to actually directly connect their viewers to the vaccine very quickly. So with all of this, we certainly hope and see that folks, better understood, accepted, and obviously navigated the process to access vaccines. Next slide. So there's lots of lessons and certainly too many to cover today, but just wanted to highlight a few key takeaways that we've seen in the last 6 months that are really helping to inform how we'll continue to work as we really get into the hard stuff. And I'll talk a little bit about that in a second. But hesitancy really comes in all forms and definitions. Again, we really see this as a personal journey that are impacted by so many factors, some social and some cultural, but those are important things to take into account. And I think those are things that you all have also reminded us along the way. We also really acknowledge that people want to see others that look like them as their messengers, and that there really is no substitute for peer-to-peer engagement. It continues to be the most effective as we forge ahead. Also, creating the space for collaboration, much like we're doing in our collective impact tables, is essential. We can go so far alone, but so much further together. And so again, continuing to leverage those collaborative opportunities to reach people. And last but not least, we're learning more about how people are using our translated materials. We've been able to produce so many things in so many different languages. It's been a center point for how we've deployed even things like our call center with more than 250 languages. And so as we continue to look at the rates of utilization and how we're going to get deeper into specific communities, really prioritizing translated materials that work, but most importantly, that are utilized. So as we continue. We look forward to sharing those materials and asking for your help in continuing to disseminate them, as we certainly don't want them to be sitting on a state shelf proverbially. Next slide. So with that, I'll give you just a quick preview of where we're headed, and then look forward to any questions you have. As we move forward, as I mentioned, it really becomes more surgical and, focusing on those communities that need the most support. So next slide, please. Dr. Dominguez has come with a few of the research sort of findings more deeply, but we were able to get back our next month of tracking survey data. And we just wanted to pull out a few different things. As we look at trusted messengers, there are many that remain, many that are effective, our community-based organizations, et cetera, but two that we wanted to highlight continue to rise to the top, which I know we all are and get to fulfill as family and friends, as being one of the key trusted messengers, but also primary physicians and medical professionals, right? We recognize not everyone has a primary physician, but they do have these types of individuals that they look up to for this type of information, especially for their children. We've also been doing some research around youth, where this is becoming prevalent, as to who they will look to really help them guide, again, their personal journey to getting vaccinated. Motivators continue to be similar. When folks understand that the vaccine is safe, feel that it's been well tested and effective, that's generally one thing to help move them. And again, eager to move beyond the blueprint. They want to return to normal. So making sure to continue to highlight that will be important to us. And vaccine barriers continue to be similar, but again, for some of our families, really the questions around long-term side effects and mis and disinformation in this space continue to be prevalent. We really want to continue to message around, a science and fact-based first campaign. As there are still some that also believe, the vaccine was developed too quickly, and question why we continue to encourage vaccination, as the Department of Public Health. Next slide. So a couple other things that we will need to take into account as we move forward are things that we can be as prepared as we can for. And certainly we'll look to good planning, but using that data first approach, getting even more surgical at a zip code and census tract level. And coming from the census, I recognize not everyone comes with this geographic knowledge, but census tracts being even smaller than zip codes. Really to inform how surgical we can be, again, with our resources when it comes to CBOs that might go out and knock on doors, or how we might be able to buy digital ads, for example, to make sure that the message really resonates with that particular community and the profile that we might know about it. Continuing to focus on our Q1, again, our North Star, and really starting to prepare families for vaccinating children. We know there's a couple other things on the horizon relative to federal authorizations or approvals around, the possibility for full FDA review and approval for some of our vaccines, but more importantly, that the under 11 group of Californians may become eligible later this fall. So we want to make sure that families are prepared for that, especially as they think about going back to school. And last but not least, as our team continues to track variants and the conversations around boosters, to the extent that those will also be conversations we'll need to have with Californians, and really being able to also help prepare some of our smaller providers, those that live within our Vaccine for Children's program and so on, to really help us be trusted messengers as well, as some of these conversations are very similar to what we have every year to make sure that kids get vaccinated in whichever particular category that may be. So with that, Bobby, I think I have had too much caffeine as usual and spoken entirely too quickly, but I'm happy to take any questions that folks have for as long as you'll let us.
You bet, Sonia. Great debut at CVAC, although Sonia's been in the background for every meeting, working hard on our behalf. So we've got time for a few comments or questions for Sonia about where we're heading with community outreach and engagement. So please raise your electronic hand and I'm happy to call on you. Deborah, we'll hear from you first. Don't forget
Hi.
to introduce yourself.
Okay, hi Sonia. My name is Deborah Shade. I represent the California School Board Association, and thank you for your great presentation. I think one of the things that kind of leveled or rose at the end of your conversation was this next wave of vaccinating our pediatric patients. And for us, it's basically our population. So our population, other than our employees, is now, you know, the lower grades of our school population in California. I know that you've been in conversation, or CDPH has been in conversations about having vaccine, you know, pop-ups or something like that. Do you see the schools? I mean, we weren't listed in your trusted messenger, and I certainly, for that population, I see our schools, especially elementary schools. Is there some conversations about that for this fall so that we can get rapid immunization for all students, so schools can, you know, remain open next year without any variant issues and other? Thank you.
Yeah, and I'd like to ask Dr. Pond maybe to help with the first part of your question, which was relative to site-specific vaccination.
Sure. Yeah. Thank you for asking. This is actually something that I'm pretty passionate about. One of my big projects before I came to the state was working on school-based flu vaccine clinics, and we blanketed the city of Oakland and demonstrated Oakland schools actually, and demonstrated that we decreased flu hospitalizations compared to a control school district. So we're really gearing up right now to really increase our presence and resources to help local health departments, school districts, and others think about school-based vaccine clinics. And not only for the students, but for the families and their loved ones. There's another opportunity to get more people vaccinated. So we're actively working on that.
And Deborah, we're working on more tools to empower the many trusted messengers, both within our teachers and our professional staff and so on and so forth. You know, all of the associations affiliated with, you know, our schools as we move into the fall. So I'm sure we'll be bothering you very shortly with more things to help us with.
Yeah, and I just, as a follow-up, I know I just keep hearing, you know, yesterday I heard about an issue with inflammation of the cardiac tissue, and there's other stuff out there. So I just hope that a lot of that push is to really get that trusted medical information out there as well, because that will be the barrier for any parent with a young child to move, you know, toward vaccination.
Thank you, Deborah. And we're going to talk a little bit more about the inflammation issue in Erica's comments later. And also our Western States Scientific Committee is meeting tonight to discuss it also. So stay tuned. We'll keep you posted on developments in that arena. Anyone else would like to make a comment or ask Sonia a question about the next steps in community engagement and outreach? Denny, please don't forget to introduce yourself.
Thanks, Bobby. Hi, everyone. Denny Chan from Justice and Aging. Hi, Sonia. Nice to see you again. Thank you for the really great update. My question is about the underutilization of specific languages. If you're able to say a little more about which types of languages are being underutilized and whether that's matching any of the under-vaccination rates in certain HPI zip codes, and whether you've done any of that mapping, and maybe just a little more detail on how you're planning to use that information about the underutilization. Thank you.
Yeah, of course. You know, naturally through any campaign, we've got a number of sort of statistics, you know, metrics, so on and so forth that we continue to track. One of those obviously is around website engagement, both with our COVID-19 webpage, but also with our Vaccinate All 58 webpage, where we're seeing a handful of particular languages, English and Spanish prevailing, Chinese, Korean, and Tagalog. As a handful of those that we sort of see more frequent visitors. So as we continue to look at, you know, print production, you know, obviously getting some of the feedback from our CBOs, you know, those are places that we'll sort of continue to focus and look forward to, you know, I think more of the work that you're talking about, doing, you know, some of that crosswalk. As we look at sort of the Q3, quarter 3, quarter 4 deployment for the campaign.
Great. Dr. Wasserman, why don't you go ahead? And this will be the last question, then we're going to move on to our member reflections. Don't forget to introduce yourself, please.
Yeah, thank you. You've guys done a great job, also done a great job of highlighting that we still have work to do in communities of color and poorer communities. And it just strikes me that this is not something that we can let our guard down on. I mean, this is still, the numbers are not where I know we want them all to be. So how can we continue to help, and what efforts are being made to continue to really work on that? Because as we hit the Delta variant, I'm concerned.
I want to speak to that for just a second, and I see that Dr. Pond has more to add as well. When we met and we had a subgroup of this body meet to talk about equity, one of the things, if you guys will remember, I said, we're going to need your patience as we are recognizing that doing this work that is trust building work, that achieving, driving towards equity takes longer, right? And having I will say, just from my experience of having done this work in a very, very vulnerable community in San Francisco, and a very diverse community in San Francisco, and it's about sticking in there. And the important thing, I think, one of the critical things about the equity work as we're moving forward, even though this is our last CVAC meeting, is that we just have to stay with it, stay in it, continue to focus our time, our attention, our resources, our data gathering, all of those pieces, and recognize that we have to continue to put in this sustained effort, even after our state has reopened and all of those different pieces. And so we hope that that you all will continue to be partners in that process. And I think Dr. Pan is gonna highlight a little bit more of that further down in the meeting.
Yeah, in fact, maybe we can talk more about it later, but absolutely, that's what we want to talk more about, and make sure that we continue ongoing relationships with all of you. So we'll be talking more about that.
Great. Well, I think now, Sonia, thank you so much for this great update and for answering the questions posed. Now it's time to shift to hear from our members. So just a reminder to our members of the Community Vaccine Advisory Committee, but also for the public, each member of the Community Vaccine Advisory Committee was asked to prepare written reflections about the process that we've been through together, the good, the not so good, and the lessons learned. More than half of our members wrote what amounted to 50 pages of incredibly thoughtful reflections that we hope will become the foundation for an in-depth after-action report and discussion about California's response to the pandemic. The reflections that they've provided are posted for the public to read, and were also circulated earlier this week to all of the members of CVAC so that they would have time to review them in advance of the meeting. I think we all are appreciative for everyone's honesty and thoughtfulness. So we've asked one member of each of the sectors represented on this committee to summarize the comments of the CVAC members from their sector in about 1 minute, a pretty fast-paced approach to these reflections. And we hope that will leave time for other members to add additional reflections in the time that we've allocated. So I'm going to start by calling on the members of the committee that are going to present the reflections from their sector. So we're going to start with Dr. Henry Tan, who on the committee represents the California Medical Association and who is going to speak on behalf of the healthcare sector's reflections. Dr. Tan?
Thanks, Bobby. So there were a number of themes that came up in the health sector, and I'm going to try to represent those themes. So there was a strong appreciation for the dedication, the leadership, and facilitation of the state team. And a comment was, we'd like to express gratitude to Dr. Nadine Burke, Dr. Erica Pond for their leadership. No doubt CVAC members felt heard and valued. Thank you to Bobby Wunsch, who managed the difficult task of coordinating the committee's efforts with great skill. And so that was definitely a strong theme. There was also a strong appreciation for the centrality of health equity. The process for deciding COVID-19 vaccines, how they would be allocated, was indeed challenging, and having a clear foundational and procedural allocation equity principles was of great importance. The explicit attention paid to health equity, embedded into the process, the structure of vaccine prioritization, outreach, and distribution was unprecedented and should be a model for others to follow. Having said that, there were also a number of comments that asked for, wish for more clarity about the role of CVAC and more influence for CVAC members as well. There was a lack of clarity with the role and the scope. For much of the time that we met, I was unclear about following up with CVAC recommendations. What was my role in communicating to community members and CBOs? I just wasn't clear about that. And at times, this lack of clarity led to frustration and confusion. I had an issue with the abrupt changes in the policies, like the deprioritization of worker eligibility, the contractual agreement with Blue Shield. These changes were often made without consideration of community member input. And so that's where the sense of being more included in the decision-making process. Another comment was that recommendations coming out of the CVAC weren't always implemented as originally intended. But there was also understanding that this was the nature of an advisory committee, and that constant flow of information through the pandemic necessitated frequent changes in the course. But I think that there was an opportunity to do better. There was an appreciation of and a need for more data. We understand that the public health department was pretty overwhelmed and really stood up I think, valiantly to get that data. But there was still the understanding that the better we understand the problem, the better our solution will be. I hope that we can continue to work on to prioritize and improve our data collection and reporting system. And there were a number of comments about specific groups, definitely the disability community, behavioral health clients, farm workers, older adults were areas, groups that needed more data elucidation. As was mentioned earlier, the diversity of the CVAC membership was often cited as one of the greatest highlights and strengths. The most rewarding aspect of being in the CVAC was hearing and learning from fellow CVAC members, and I include our co-chairs and state representatives as well. I deeply appreciate the chance to learn how the pandemic affects farm workers, low-income families of color, community health workers, older, limited English proficient persons, and so forth. But as was also mentioned, while this was a strength, it also offered some challenges. It was important for CVAC to have broad representation. However, the large number of participants made it sometimes difficult to participate in the meetings. Upon reflection, I believe that it would have been helpful to create work groups by sector to address some of the issues. And there was also a recommendation that to ensure the diversity of voices that are heard, there could be facilitation to really encourage or put space out for CVAC members who don't always speak up, to allow them that space and time. And then finally, in terms of looking forward, there were questions and comments about how do we take these lessons learned, the infrastructure built, and extrapolate that to improve our public health and health delivery systems. And there was also comments about, given the current state of the pandemic and vaccine penetration, that we are not at our goal, that the work continues to need to be done, to eliminate these disparities. We understand that these disparities are deeply rooted in racial and social inequities, and it requires a long-term perspective to dismantle these systemic issues. And that is the big task, which is, quote, why we must keep up the momentum of CVAC, continuing bringing people to the table, investing our time and energy into making these changes a reality. Final comment I'll make is that another member said, we haven't run our last mile yet. We did a lot of work to prioritize, to systematize our delivery process, but we haven't really talked about how to deliver the vaccines, and that's work that still is developing. And I think many would say the ongoing work of our state and of CVAC as well. I hope I did the members of health justice here. Thank you.
Thank you, Dr. John. We're going to go on to Preston Young, who on CVAC represents the California Chamber of Commerce and is representing the business sector.
Hey, thanks, Bobby. Good afternoon, everybody. Thanks for including me in this process. Much appreciated. So, speaking from the business sector's perspective, obviously over the last year, it's been tumultuous and difficult like it has for everybody. There have been businesses that were shut down, they were open, they were re-shut down, they were reopened, there were capacity limitations. A number of small businesses spent immense amounts of money putting in safety precautions so they could have customers come in. So it became very apparent very early on that there needed to be a catalyst for reopening. And that catalyst naturally was the vaccination. So once that was identified, the next problem was, okay, well, how is it we get this out? What is the process going to be? And so businesses had a number of questions and they lacked a number of resources. And so CVAC, I think, provided a rather advantageous place for people to come as a resource and get answers. And maybe those answers led to more questions. Obviously, it wasn't a perfect process, but I don't think anything over the last year could be characterized as perfect. It's been a very, very difficult year. And I think the CVAC process for businesses and small businesses that gave them the opportunity to be heard, gave them the opportunity to voice concerns. I know I had a number of members come to me and ask how to get involved in this process and where they could go to get answers. So the CVAC process, it certainly pulled the curtain back in a number of areas and served as a resource. But that being said, we had a lot of members and a lot of opinions, and at times the process was a bit unwieldy. There were questions that maybe didn't get an answer or perhaps an unwieldy response, but nonetheless, at least we did have a process, and that's what a number of businesses have told me and shared with me is thankfully there was a process. It let us know there were tiers and how that process would work. So at this point in time, I think CVAC, while it wasn't perfect, certainly contributed to the vaccination rates we have and the optimistic story. California, you can tell we have low hospitalization rates now. We have low case rates now. And California's reopened. Obviously, we have not crossed the finish line. There's work left to do. But a huge thank you to Dr. Pond, a huge thank you to Dr. Berg, a huge thank you to Bobby and everybody else that has been involved in this process. So I appreciate the time and thank you for letting me share the sentiment.
Thanks, Preston. And we're going to go on to Chuck Helga, who represents the California Association of Veteran Services Agencies, speaking on behalf of the veteran sector. And I just want to remind all the members that are speaking, we really need to keep our time to the 1 minute that was suggested earlier. Chuck?
Thank you. This effort has been an incredible challenge and an incredible learning experience. And I think everyone almost shared that in their comments today. My closing comments are going to be very brief and focused again on our homeless community, of which veterans are a significant and disproportionate share. As our public officials that will lead and carry on this vaccination effort, I just would respectfully request that you don't forget about them. It's a community that doesn't get raised very often. Again, that is for me the most important issue that I can raise at this point. Thank you all for your respectful and effective leadership and advocacy.
Thank you, Chuck. Let's go on to Deanna Telfason-Torres, representing the UFW Foundation and speaking on behalf of the agricultural and food sector. Deanna?
Well, thank you, Drs. Burke-Harris and Pan and Bobby and your teams for your extraordinary leadership and for placing equity at the heart of these efforts. The group appreciated the insights and the data provided at each meeting and the opportunity to engage with others who, from their unique spaces, we're also trying to obviously effectively use limited resources to stem the devastation of this pandemic. Undoubtedly, many farm workers' lives were saved when CDPH prioritized them for vaccine distribution and then centralized pandemic responses and guidelines to ensure that counties addressed the needs of this vulnerable population. Similarly, the governor's and CDPH's decision to allocate vaccines for ag workers aided mobile vaccine efforts. Farm workers are still citing the fear of losing work days due to side effects, as many employers don't inform workers about sick leave. So there's a real need for CDPH and other agencies to increase public education, to ensure that workers are aware that their employer legally must provide sick leave. And once again, data on ag workers should be disaggregated from other food industry data, given the migratory nature of ag workers. I know we've mentioned that quite a bit in the past. And lastly, California's investment in the outreach and the mobile vaccination efforts will continue to be necessary beyond the reopening, and we continue to be your partners as we ensure farm workers' safety. And once again, thank you all so very much for the wonderful work you've been doing all along.
Thank you. And we're going to go on now to Carol Green, representing the California State PTAs and representing today the education and childcare sector. Carol?
Just make sure I can unmute there, sorry. Overall, the folks in our sector felt that the process was fair and inclusive. They really, we all really appreciated the overarching safety, equity, and transparency goals, which we realize ebbed and flowed, but we felt for the most part were on point. We appreciated the preview and the explanation as the tiers were changing. This was also a bit of a frustrating point, but not because it's anyone's fault, just because pandemics are unpredictable. And we appreciated the fact that although all the members advocated for a specific group or a group of specific groups, they seem to be very open and always respectful and really wanting the best for everyone in the state. So that was really positive. We really thought that the engagement and the dialogue was positive, although, and people have said this before, sometimes the long meetings and the opportunity to make your point wasn't always available because of the number of people in the meetings, but we thought you did an excellent job. As far as points to be taken away, I think that one of the things that would have been helpful, and hopefully it will be helpful in the future, is let's engage the members of this group, this committee, to make sure that we want to do something too. So if we can be the spokespeople, if we can get the message out, please utilize us. There were times during the process where I was unsure of exactly how much we should be pushing or keeping confidences. I know it's a public meeting, but just exactly what we should be doing. So that was a little bit tricky, but overall we really liked the process. And although we still have a ways to go, it's pretty positive where we are now. And it's nice to see that California is reopening and some things are back to normal. I will say for childcare, for PTA, for schools, getting younger citizens, younger folks vaccinated is really a priority, and getting out good information so that parents can make good decisions is a priority. Thank you.
Thank you, Carol. Let's go on to Dr. Moises Barron, representing the California Alliance of Children and Family Services and speaking on behalf of the behavioral health sector.
Thank you, Bobby. Really want to echo our appreciation to our co-leaders and to you, Bobby, for the tremendous effort in really leading the efforts with CVAC. I think that we all felt heard and valued. It's been interesting for me to be able to see the commonality in the feedback that we've been hearing. And I just would like to emphasize a couple of elements from the behavioral health perspective. I think participation in this group is absolutely crucial for us to be able to get clarity about access to the vaccine for behavioral health workers. And I think I want to point that out because I think it's a good example to think about for the future. Not only participation in this committee help us provide clarity and also help stress the need to communicate to counties and other public health officials. As a result of that, we were able to also quickly mobilize and scale our efforts to get our staffs vaccinated, which allows to then provide more safety as we continue to provide in-person and virtual mental health services. So I will echo something that our colleagues in the health sector indicated, that we think that it would be helpful to think about creating work groups by sectors, because not only we can provide input, but we can also help with implementation of ideas. So we believe that will be helpful. With regard to the issue of equity, I recently heard Secretary Galley say that one of the important impacts of the pandemic was the unmasking of inequities. And definitely we struggle with that firsthand. I was pleased to see that there is some efforts being made to try to reflect and catalog the lessons learned with this very significant initiative. And hopefully we'll be able to continue to put those lessons to good use into the future. And don't want to repeat other things that have been said already, so I'm just skimming through some of our comments. But one thing that I wanted to stress is that we believe that the vaccination effort clearly put in display the importance of partnership between the public, private, and nonprofit sectors. And we hope that such an approach will improve to guide such state initiatives into the future. We know that now that we emerge from the pandemic, we will need such coordinated approach to address the mental health crisis that has been made worse by COVID-19. And we really, again, appreciate participation and our participating with our colleagues, getting to know many of you, and again, the leadership that was provided to this effort.
Thank you so much. We're going to go on to Rhonda Smith, who represents on CVAC, the California Black Health Network, speaking on behalf of all of the BIPOC community representatives who are on CVAC. Rhonda?
Yeah, thank you, Bobby, and thank you for the opportunity to share what the BIPOC community feedback they had to share. And so just in general, some of the common themes were obviously everyone was very grateful and appreciative of the leadership of the CVAC committee and the committee itself, and believe that it really made a difference in keeping the disparities gap from widening even more than what we experienced here in the state. They also appreciated the connections to various individuals and organizations that they otherwise wouldn't have the opportunity to connect with, and definitely appreciated having the diverse representation based on race and ethnicity on the committee, and having a seat at the table to provide input, especially when it came to really ensuring that there was an equity lens focus for the work that we were doing. They appreciated the accessibility of the committee leadership and the transparency in sharing some critical information that they felt was really helpful in getting that out to their community to keep them informed and up to date. And so something that Dr. Burke-Harris alluded to earlier and comment was that, health equity, they appreciated the health equity lens and operationalizing health equity matrix, but at the same time, this work is very hard and also very messy. And a lot of times it seems like the upstream part of the strategy and the intent of the strategy wasn't always translated into what was intended to happen and have the kind of impact downstream at the community level. So we still have a lot of work to do, and we still see a gap in terms of the vaccination rates and some other things when it comes to accessibility and disparities there in the community. So, but just in general, we all really enjoyed being part of the committee and being able to contribute and help make progress. So thank you.
Thank you, Rhonda. And next we'll go to Denny Chan from Justice and Aging, speaking on behalf of the older adult and long-term care sector. Denny?
Thanks, Bobby. In my sector, my colleagues and I were first, as a threshold matter, incredibly humbled and thankful for the opportunity to participate on the CVAC, to elevate the concerns of older Californians and those in long-term care settings. My colleagues and I particularly appreciate the early prioritization of older adults in the eligibility categories, eventually prioritizing all of those on home and community-based services, and even most recently creating processes for in-home vaccinations. We are encouraged by statistics, but note that the progress is indeed a moving target, whether we're talking about individuals who are transitioning to nursing facilities or the ongoing concerning low vaccination rates among Latino older adults. And so we really encourage the state to continue to break down those barriers for older adults to get the vaccine. Our advocacy efforts, as others have noted, were complicated and continue to be complicated by our inability to get real-time data, whether it's specifics at institutional infections or intersectional data with respect to race and age and other immutable characteristics. Some of my colleagues expressed that the size of the group and the public health emergency, the nature of the emergency, made it difficult to get answers to our questions that felt really timely and important, especially since older adults were some of the first to be eligible as we were rolling this out in January. And I think as a threshold and sort of a key matter, the impact of COVID-19 on our communities, disproportionate illness and death, especially in communities of color and congregate settings, although we've officially reopened as a state and many people have been vaccinated, the impacts of the past year and a half, that trauma is long lasting for the older adults who we serve, whether those people are in nursing facilities or have had to shelter in place for so long, as well as their caregivers and their advocates. And so that's really an ongoing lesson that we want to continue to think about and reflect on as we build toward a better future in California. And of course, last but certainly not least, we reiterate our gratitude to Drs. Pan, Burke-Harris, and a special shout out to Bobby for her skillful facilitation in making these meetings as seamless as possible. Thank you.
Thank you, Denny. And now we'll hear from Lisa Hershey from Housing California, representing the housing and homelessness sector. Lisa?
Thanks so much, Bobby. It's such an honor and a pleasure to have served on the CVAC, the opportunity to share brief reflections on behalf of the homelessness and housing stability or instability sector with all my esteemed colleagues today. I will provide my reflections in 3 quick categories, including 1, the process, 2, successes, and 3, lessons learned. First, the process included 3 key strengths that benefited people experiencing homelessness and housing instability, including 1, seating the right people to lead, facilitate, and serve, including our courageous leadership, Dr. Burke-Harris and Dr. Pan, our savvy facilitation during meetings, in between meetings, the glue that kept everything together, Bobby, our deep state support from the governor's office to our agencies, multiple agencies and state departments, and the amazing committee members. Secondly, identifying and confirming what success looked like from the front, expectations with, and accountability for all of our parties from the onset with a values-driven, equity-centered process. And third, really staying adaptive, resilient, and committed to staying on course. This process also had a few bumps that have been mentioned by my colleagues, and I'll just mention briefly the ones that impacted people experiencing housing instability or homelessness the most. For purposes of brevity, I will focus on 2 key issues and related considerations. We knew almost from the onset, public health told us, healthcare leaders recognized that being able to shelter in place in a safe, stable, affordable home was the best prevention from contracting the virus and fundamental to stopping the spread as well as recovery. Unfortunately, in January, the state shifted from the initial prioritization to the age-based system vaccine priority framework. That age-based framework eliminated any priority for people living in congregate settings, including shelters for people experiencing homelessness, prisons, jails, immigration detention centers, etc. This sudden shift to deprioritize people in congregate settings, and I know we did do some adaptation, but it really was a challenge to us because we said that equity is at the center, and it really threatened our ability to serve folks that were already at risk prior to the pandemic and at greater risk during it. As members of CVAC and other organizations with community equity expertise in California, we requested that CDPH immediately make clear that people in congregate living environments are prioritized for vaccine access and distribution at the state level, and release that plan for operationalizing it. What we learned from this is we really need to stay the course, invest deeply, and support fully the public health infrastructure and nonprofit sector organizations on the ground that already hold trusted relationships with the community, that focus on prevention, keeping people healthy, safe, and sheltering in place with the resources needed, regardless of what we're trying to solve. We've got that infrastructure and we need to keep it safe and sound. From an accomplishment perspective, we see from this perfect storm that transformation can be born. We're grateful to the governor and the administration for the courage to lead with equity, truly engage this enormous advisory committee and the public in this inclusive and clear process. The CVAC, with its strong leadership, facilitation, and multifaceted makeup, we believe successfully created a statewide equity center plan to guide the equitable vaccine distribution system that considered key factors impacting people and communities, most notably from my perspective, people experiencing homelessness or housing instability, like poverty, job loss, housing and food security, segregation, disinvestment, exclusion, and displacement. We're thrilled that CVAC brought in the experts from different spaces and places, and for example, provided me the opportunity to bring in Dr. Margot Kuchel, who is our housing as health expert connecting to homelessness and how this was translating on the ground, the resilient opportunities and lessons that we learned that could be applied and scaled statewide. We also really appreciated learning from other communities in what were real-time solutions that we could spread across the state. We extended benefits and protections to all people regardless of their immigration or housing status, and we began to use data and publish data to track and improve racial and disability justice outcomes. We expanded capacity to robustly respond to crisis statewide and at the state level. The bottom line for us in terms of lessons learned are threefold. One, we need to focus our efforts, energy, and resources first on people and communities who struggle the most to make ends meet. They're mentioned across the board here, are Black, Indigenous, people of color, other people of color, essential workers, low-wage immigrant communities. I will note it's explicitly people that are unsheltered or experiencing housing instability. Well, we need to meet people where they are in affordable housing developments, homeless encampments, on the street, and build off existing relationships with trusted messengers from communities and nonprofits connected to local government, business, and other community organizations and services. And finally, we need to invest deeply and sustainably through an equitable social determinants of health framework to scale our local successes and concretize California's locally connected, regionally organized, statewide public health and community benefit infrastructure, constructed first through the Complete Count Committee and the 2020 experience, and strengthened and refined through this COVID-19 emergency response. Thank you.
Thank you, Lisa. And moving on to Mitch Steiger from the California Labor Federation representing labor. Mitch?
Yes, thank you, Bobby. Overall, very much appreciated the opportunity to be a part of this group. And as an institution, we think it was a very effective and helpful and necessary step. And one of the ways that it was so helpful was in giving us a direct line to agency officials to help convey the perspective of each group. It would have been a whole lot less efficient for us all to try to do this on our own, all of these groups, bothering all of you in all sorts of different ways, that to bring it all together into one big group, in a lot of ways really did, we think, streamline the process in a lot of helpful ways. It was also great to get regular updates on distribution metrics that allowed us to help affiliates and members make good decisions about how to be helpful, especially when we did begin using our facilities to distribute vaccines to workers. Knowing where we were and who we needed to focus on the most was incredibly helpful. And as others have mentioned, Bobby was incredibly responsive and always did the work to get timely answers to our many, many questions. And that did a lot, we think, to really facilitate how well the process worked. As far as some areas for improvement, as others have mentioned, the committee did seem prohibitively large, and that probably contributed to a sense among a lot that we were really there more to report back to our people than to provide feedback that would then influence the process. And a solution many have mentioned is maybe some sort of work group, whether industry or sector specific or otherwise, maybe breaking us off into work groups that would then report back in some sort of way might be one solution to that in the future. And as Aaliyah from the labor side mentioned, I thought in a very memorable way, we may want to focus more time on the how than the who, that especially early on when we were all really focused on the mechanics of distribution and the logistics of it, it felt like we spent a lot of time focusing on research that, while very helpful and informative, seemed like a lesser priority than figuring out how we're going to get vaccines to the right people at the right time. as quickly as possible. And as much as we would like to think that this was the last one of these, it is not. We think we can expect more of these. And so we think it's very important to institutionalize this process in this committee, because as long as we keep eating and raising animals raised in terrible conditions and then forcing workers into those conditions, all the ingredients are there for another pandemic anytime. And we should keep that in mind. Even here in the United States, one could pop up any moment. And so everything that we set up to help deal with COVID-19, we think needs to stay in place and help be improved and ready for the next one, because sadly, we do think it's coming. But overall, very much appreciate the opportunity to be involved, and thank you for the opportunity to speak today.
Thanks, Mitch. Next is Sylvia Yee from Disability Rights and Education Defense Fund, representing people living with disabilities.
Thank you, Bobby. I will do my best to summarize the reflections of people with disabilities and disability advocates on the CVAC. I've organized according to emotional states, which I will say and which I will also try to represent on camera. Stoicism. Almost 80 widely diverse and deeply invested stakeholders working for consensus on nothing less than life and death. It was a difficult place to be, but for the disability community, whose foundational motto is nothing about us without us, there is no other place that we would rather have been. Surprise. We were dismayed when the CVAC members were apprised of major changes after they were publicly announced. And in particular, the state's turn in January to an age-based framework for vaccine prioritization that seemed to overturn the equity framework that we all had been working toward. And later on, the decision to retain a third-party administrator that also introduced a lot of fresh uncertainty into both prioritization and how vaccine booking, distribution, and on-the-ground delivery would work. Worry. We were called together for vaccine prioritization because basic eligibility is the gateway to vaccination, but it didn't mean that gateway was necessarily accessible. Nothing about vaccination was easy for many people with disabilities, from getting appointments to transportation, getting the shot. We remain anxious about people with disabilities and older persons who need house call vaccinations and their physical, emotional, and mental state as they wait while the rest of the nation opens up. And we remain worried about children with disabilities as well. Grateful. As disability advocates, we got to work as a team, and the fact that it wasn't just a single one of us called as a token member to be on the CVAC was very encouraging to us. We are also grateful for the opportunity to actually influence the inclusion of people with high-risk conditions and high-risk disabilities into California's vaccine prioritization, and also that we were listened to as in getting vaccine providers to determine eligibility for this group through simple self-attestation. Hope. Looking forward, as we must, this entire experience shows what is possible and what must change. It is possible to have respectful interaction, commitment over months, and deep learning among a huge group of stakeholders operating under stressful, urgent conditions. It just takes Bobby facilitating and co-chairs who can stay enthusiastic without ever getting sleep. The things that must change are how this state collects functional disability information in multiple contexts and how public health is conducted. Disability must be better understood as a population that is subject to health and healthcare disparities with or without a public health emergency. We still don't know from the slides shown earlier how many people with disabilities have been vaccinated in the community, and we may never know. If we never know, it's hard to talk about equity for that population. Ultimately, our belief is that the allocation of healthcare resources, whether we're talking about crisis standards of care or vaccination, needs to be based on living with a disability, not dying with a disability. Thank you very much.
Thank you, Sylvia. And now Dr. Eric Surjenko from Mariposa County, representing the county local health officers. Eric.
as well representing CHIAC, the California Conference of Health Administrators. And I'll be brief, is that this was a good venue for us to serve, to listen, to receive your information, and that alone made it valuable for us that we could communicate that to our local health jurisdictions. But looking at things that could have been better is how could we have been more effective in sharing our message? That is, how can we effectively work as local health jurisdictions with those community-based organizations taking the actions that were occurring or the conversation that was occurring at the state levels down to the local levels. And so recognizing that the pandemic isn't over, I'd say that taking forward from the end of the CVAC is encourage those that you represent at the state level, take the message back to reach out to your local health jurisdictions and make sure the work that we've talked about here gets done where the boots are on the ground. Thank you.
Thank you, Eric. Brian Lamora from the California Endowment. Brian?
Thank you, Bobby. I won't cover ground that others have spoken to already, but particularly appreciate and would second the comments from folks like Dr. Barone, some of the challenges Lisa Hershey lifted up, Sylvia Yee, and others. From the philanthropic perspective, I found the CVAC presentations valuable that describe the various funding opportunities available for CBOs and the progress made in funding those CBOs to respond to the pandemic, both from state funding sources and collaborating philanthropies. The funding streams are complicated with different sources, application processes, timelines, et cetera. Yet the funding opportunities in the CBOs that have been supported are providing critical support to complement, extend state and county efforts, and are really leading local efforts via trusted grassroots organizations and people. A related accomplishment was, in fact, the increased recognition and role that CBOs play in reaching diverse communities in culturally responsive ways. Funding from the philanthropic community and state sources, which Sonia Harris described so well today, through the Public Health Institute, Sierra Health Foundation, Get Out the Vax effort, provided for more coordinated and complementary funding across the board, which was essential. And it's been the CVAC meetings which have provided for the critical space for its members to consistently advocate for a prominent role and support for CBOs, those closest to community, which in the end have been, certainly an essential component to the state's successful response to the pandemic. So I appreciate the opportunity to share today and to have been part of the CVAC. Thanks.
Thank you, Brian. And certainly, last but not least, Anthony Wright from Health Access, representing all of you health advocates who are part of CVAC. Anthony?
Yeah, thank you, Bobby, and thanks to not just our leaders on this adventure, but also all the CVAC members for all the time and attention we put into this. It was impressive. We very much appreciate the intentionality and sincerity of the commitment to equity and safety and transparency, which was embodied in the creation of the CVAC. I think just the time and information that was provided was essential, not only for us, but for the broader public who had all these questions that we tried to sort of convey. And so I agree with some of the earlier comments that was just an essential part of this. I would also say that if it was such an essential part that we should have made that more explicit, that was part of the effort here. And maybe that was a more important role than the actual influence we had on the decision-making. Reiterating my comment, my colleague Kieran Savage commented that it was the most diverse and inclusive public stakeholder process she's been part of, and that's for commendation and replication, and I agree with her on that. Maybe it could have benefited from subcommittees or structure. I think we tried to use what we could in terms of the chat and other functions to try to work with the size of our effort. And in terms of the issue of equity, and I think this did underline for us the importance of, and that an explicit focus is not just on social vulnerability, like something like the Healthy Places Index, but also explicitly on racial equity and intentional community engagement. The comment that I would like to just and with this, I really am appreciative of like not just the lessons learned, but the infrastructure we built and making sure it just doesn't all go away. You know, and I would love to know what's going to happen with my turn, with the relationship that has been recalibrated a little bit between on the ground delivery and statewide accountability, with regard to the way that the public health system had to work a lot closer with the health delivery system in the delivery of these efforts, and how we can do that for not just the next pandemic, which but for the booster shots that we may need next year, for the flu shots that we do annually, that we don't do that we do less than a majority of every year, even though that's something that is supposed to be covered by you know, in our health plans, in our health systems. And how do we get that up from less than 50% to 70%? How do we do other public health interventions, and how do we use the infrastructure we have before it goes away to do that? And I would love if out of this, and maybe CVAC is part of that infrastructure that we save in some way, maybe not with the regularity that we were meeting earlier, but in some specific way, because we, you know, this is not the only public health challenge we face, and we shouldn't have to have a pandemic to do it. And so we're for that funding, and we're advocates for that. But is there a way that we can take advantage of the infrastructure we've already built, and can we even make some of those commitments now about whether it's the flu shot or some other public health issues we have? Thank you.
Thank you, Anthony. Thank you all for your incredible, thoughtful, and frankly emotional comments. And now back to Dr. Pond.
Thank you so much. And actually, that was just a perfect segue, actually. But I want to again say it's been so powerful to hear all of your comments and insights. And again, having reviewed the really thoughtful written input that all of you have put forward. And just to reiterate what Nadine mentioned earlier about the power of the collective, just seeing kind of the colleagues in the chat and giving each other kudos and in our virtual world that we've learned how to do. I want to mention a couple commitments before I kind of speak to a few other things. We are already engaged in an interim after action report where we're focused on our communication and our coordination. These detailed comments, both written and from the meeting notes today, will be shared with our team working on this. When we are truly beyond this pandemic and SARS-CoV-2 is just another vaccine-preventable disease, we will work also on a larger after-action report effort and ensure we're going to continue to get input from various stakeholders, including this group. You know, as mentioned, it's just been a fast-paced evolving with lots of curveballs thrown, but you have all hung with us and been patient, and really hope that you do continue to do so. Just on the heels of Anthony's comments, we're actively also engaged in a process to envision our goals for a modernized public health infrastructure and system for California. Many of you know, and I think Anthony was alluding to this, you know, we've just not had a lot of resources, and a lot of divestment has happened in public health, both at the local and state level over decades, actually. So we need to improve our resources to continue to lead and protect with equity, health, and transparency, and community engagement and collaboration across all sectors, not just government and CBOs and safety net, but, you know, again, it's great we have private sector colleagues here as well. And it's so crucial during times of crisis, but also really to make any systemic change. As again, many of you pointed out, we have to aim to do everything we can to note what we can do better moving forward, have these cross-sector collaborations, and build on the relationships and systems that we have started during this pandemic. So we are very interested in committing to that as well. So to move to next slide, to talk about what's ahead for California. You're all used to seeing this. This is just that we are at a very stable place with some of the lowest case rates and test positivity in the nation. I will comment that we're seeing, you know, we had a large decline and maybe a little bit of stability and maybe a little bit of a bump post, you know, it's been a week now since reopening, which we anticipated. So we're watching this closely. We've already highlighted a number of vaccines. So next slide. And you've all seen me show this, but I just, again, as far as reflecting over the course of the pandemic, I think the blue, just to quickly highlight, the blue is the peak of actual cases, and that winter surge is the big one. And then you can see the hospitalizations are the orange line, ICU is black, and then the deaths have been sort of put to scale just so you can see them, and that they tend to lag. The vertical lines actually show us when we got to 10% is one asterisk, 20%, 30%, and 40% vaccination rates. So you can see actually it's been an incredible opportunity, especially now that there's just a moment to pause and reflect, but to see how quickly vaccines can work, and just see this unprecedented timeline of seeing millions of doses administered, and such effective vaccines that were developed. So really grateful to see those trends. Next slide. And then I've been highlighting this, I think, intermittently with all of you, but just to show you the data we do have. This is collected from a combination of blood banks and also just any antibody test that is sent by a clinician, that is reportable to us in the public health department as well. And we actually have very high prevalences here in California. We'll be watching this very closely. There's a wide confidence interval here, anywhere from 68% to 85% for California as far as the overall average. And you can see some of the variability by regions. This does not distinguish between prior infection versus vaccination. But it does show you sort of how we are doing with that combination, that we do have an antibody, which is a proxy that we try to use for presumed immunity. So we've made huge strides on this and seen this increase over time with vaccinations. So this is very encouraging. Next slide. And the other interesting point, back to looking at some of our data by quartiles, we actually see again the large disparity, the disparities in the disproportionate burden amongst healthy places index quartile 1, that our least healthy communities in quartile 1 had higher exposures, higher proportion of disease, so had higher antibody levels early on. And then as we've gotten vaccinated, there's been some more balancing of that. Next slide. And then I think this is one that we've just recently put together, but I just want to again show the dramatic impact of vaccines. So this is when you compare fully vaccinated versus unvaccinated people, and how that impacts when you compare those for cases, hospitalizations, and deaths. So you can see again when we had this coming down from our surge. But for all three of these, again, very, very dramatic impact of vaccinations that you can see here. Next slide. And then a lot of people have questions about, how many people are going to break through, or we just are calling these post-vaccination COVID cases. So we continually cross-check our registry. So we have over 19 million fully vaccinated individuals as of last week. And then we cross-check that with our test positive cases in our system. And less than 1%, or here our estimate is 0.036% of the people who have vaccinated have actually tested positive. Many of those may not have even had symptoms, were tested routinely for when people were still doing screening testing of fully vaccinated people. And then amongst those, a very, very, very small number were actually hospitalized or reported as deaths. And there's more deeper dives to do to see if some of those were incidental, tested upon admission versus being admitted for COVID-19 and things like that. But this is all very encouraging data, again, about how effective these vaccines are. Next slide. Some of you asked earlier about variants. This is what we are sort of tracking as well very closely. We are looking at this data consistently, trying to get some dashboards going, but we do have weekly data posted on our website. So the trends that we have seen here are we had our own variant that was really more on the West Coast, and that has now decreased. And what seems most predominant right now is almost 60% of our isolates are the Alpha variant, or the UK variant. And but you can see actually that was on a steep rise and was becoming more dominant, but maybe is starting to even out. And then we have that, I forget the new Greek letter for P1, which is also seen in Brazil, but that is also about 10% of what we're seeing. And then not yet on this slide, because it is thankfully a small proportion, but increasing. We do have Delta variant here in California. It's about 5% right now of our most recent, sort of looking at the month of May, of our isolates. And it is increasing, and we fully anticipate this is going to become a more dominant strain. Again, well, I have another slide about variants. So next slide. So again, vaccination is really the key to protect us from these variants. Other mitigation measures that we've used in the past can help, but we have really moved to a place where that's not. All of our distancing has gone away. So vaccination really is the key to prevention. And viruses are going to, this virus specifically is going to continue to change and mutate, leading to other variants. So Delta variant is the one we're most worried about now. It certainly seems to be more infectious, and there's some data suggesting it might be more serious too, more hospitalizations. And these mutations will happen when viruses are thriving. Some COVID variants are more infectious or more serious, like the Delta. And the great news again is that these 3 vaccines we have here in the US, the data we've seen shows that they are protective against these variants, especially against serious disease. And the second dose is really important for that Delta variant. So it's really important to complete the series as well. And what we need to do is continue to vaccinate and keep these last stretches. Every vaccination is important. Every conversation about vaccination is important to help us get to equity and also really protect us against these variants. Next slide. I wanted to shift gears a bit too, since this is new since we last met. So this is what CDPH put out as our vaccine record guidelines and standards. Many of you have seen in various forms when we have issued different, in the past when we had sector-specific guidances related to the blueprint. If there's a vaccine verification process, there are definitely options. So when everyone has their vaccine administered, they get the CDC DHHS paper card that can be used to verify. And then we've just issued, as of last week, a Smart Health Card compatible reader. The Smart Health Card framework is something that is an open source. There's a link here about that. So these are options. We want to make sure that verification doesn't create or perpetuate any social or health inequities or lead to discrimination, should not create any barriers to essential services or restrict access based on a protected characteristic. But we did want to make sure that immunization records could be accessible. All of us are going to, at some point, either lose that card, it might get torn, or our paper cards are somewhat fragile in a way. So we wanted to have another option that people could seek to verify again and get a different way to get their records. So we now have a digital option. Minimal personal information should be required, and this is again one of many options. There are potentially going to be other proprietary ways to do this, but we did issue these guidelines last week. And then next slide. And then the actual state-issued vaccine record is a new tool that you can go to this website, the My Vaccine Record, to access it. It's easy to use. You enter your name, your date of birth, and either the email or phone number that you likely put into when you registered for your clinic appointment or for your vaccine. And then you create a 4-digit PIN so that it can be verified that it's you when you get sent the follow-up. And then you can get a QR code and a digital file. So this is just released as of last week. And again, this is optional, but just another option to have a more convenient way to verify your vaccination status in California. Next slide. I think this came up earlier. Another big focus for us moving forward is continuing to expand and improve as far as our pediatric vaccination. We have gotten to over half of our 16 to 17-year-olds have gotten at least 1 dose, and about a third of our 12 to 15-year-olds have gotten at least 1 dose. But we clearly have more to go to make progress there as well. So a lot of it has been actually expanding our network. So I think, as you all know, early on, again, when we had much more demand than supply, we needed high volume, high throughput, and now we really need trusted people. Sonia showed you that some of the key people who are trusted are primary care providers. So we're enrolling more primary care providers, trying to make that easier. We're coordinating ongoing community mobile clinics and really ramping up as we start to talk about school-based clinics. We're going to be leveraging the existing Vaccines for Children network that is well established and that works closely with local health departments and primary care providers, and specifically amongst safety net providers. And really starting to work with other, in addition to all of the partners we've been working on for this phase of the vaccination status, really having other partner organizations who can support expansion moving forward, and especially for this fall. So we are really working on that planning. I alluded to in the chat, so there is an overall Safe Schools team as well. It is not actually a committee, and you all planted a good seed to think about other ways we can move forward and leverage a lot of key partners here. But the Safe Schools team is it's a cross departmental effort that has participants from State Board of Education, from OSHPD, from CDPH, from the governor's office and others. And we've really resourced actually our Department of Architecture, thinking about ventilation, some resources and technical assistance to help provide guidance for schools, testing for schools. And then that group will also be a partner as we think about, again, vaccine getting out to kids and schools and also their families. So we will definitely also look to all of you, and I have some follow-up to do, as I've seen in the chat, about making sure we can engage many of you thinking about children with disabilities. I believe there are some key partners already being engaged, but we can always add more input. Next slide. So, and then this also came up briefly earlier, and especially with an eye to teens, I know this is of concern. I just want to highlight, briefly again, there are 4 huge networks that we have for vaccine safety monitoring in the United States, and California once again is a leader in many of this. We have key leaders for the nation that are here in California. You can see in this vaccine safety data link in this third one, those are actually Northern and Southern Kaiser Permanente, and Dr. Nikki Green is on our Western State Scientific Safety Group. We have representatives on many of the federal committees that look at vaccine safety. So we have a lot of strong systems that are really monitoring closely. And again, an unprecedented number of people who've been vaccinated in such a quick amount of time to see both effectiveness and safety of vaccines in the United States. Next slide. So today the ACIP met, and actually last week the FDA committee for vaccines, the VRBAC committee met also to look at myocarditis and pericarditis after mRNA vaccines, and looked also today at the benefits and risks after 2 doses by age group. And we'll make sure we get a link to all of you of the full slides. I'm just highlighting a couple of those, but what they have done is really looked at how many cases have been reported, trying to weigh again benefits and risks of how risky and the serious outcomes that we've seen of COVID-19 infection itself, how many hospitalizations, cases, and deaths might be prevented by vaccination versus the currently reported and or projected cases of myocarditis by age groups. So this is sort of one snapshot of kind of weighing that hospitalizations versus cases of myocarditis. Next slide. And then at the end of today as well, they started to look at benefit risk interpretations and limitations. And they looked at both individual benefits of vaccination versus individual risk, and then again, across sort of society, looking at that other slide I just showed you. These benefits are likely an underestimate. The analysis was using, again, reported rates of cases and hospitalizations, which we know are likely under reported and tested for. There's still some uncertainty in the rates of myocarditis after mRNA vaccines. Not all cases are verified, and ongoing investigation is happening, and crude rates were used. But when they looked at risks and benefits, and that does vary by age and sex, the balance could change with increasing or decreasing incidence. And then there's limited data still, since we've only been vaccinating 12 to 15-year-olds for a few weeks now. So we'll be, those safety networks will be continuing to monitor that as well. But my understanding of the recommendation overall is that the benefits outweigh the risks. I think the other way of looking at it, especially with these variants, from my earlier slide, is that people are either going to get infected or vaccinated. And that is really the choice, looking at what's happening in Israel, in the United Kingdom, even in other countries that are well vaccinated. The unvaccinated are still the ones that are going to be infected. And this is this virus finds are vulnerable, as we've been talking about throughout the course of today. So I think that's other important information to keep in mind. And then, as mentioned, Western States Scientific Safety Group is going to meet this evening and also kind of review the data that was presented today and come up with a Western States recommendation as well, based on what's been shared about this. Next slide. So just to kind of wind down, I think the way I think about this next phase is it's our suppression phase of the pandemic. So there are many things public health must continue. We have to continue vaccination. We have to continue to close the gaps. We have to vaccinate our under 12, which is 15% of our population alone. We have to do monitoring and surveillance. We have to keep testing. We have to really expand our whole genome sequence testing to monitor these variants. Continued case contact and outbreak investigation, having support for isolation and quarantine when needed, healthcare surge readiness, already mentioned safe schools, and then ongoing public health guidance. Next slide. So I wanted to use this slide as a bridge to, again, talk about until we get kids and the rest of the world vaccinated, we will still be responding to this virus and this pandemic. And moving forward, we're going to continue our values and focus on equity as we address all these disparities magnified by the pandemic. And there are many other outcomes that we must now address as well. Some of you mentioned this: mental health, economic recovery, which really impacts social determinants of health, and access to services that need them the most. We developed some incredible partnerships with all of you that we want to continue to build on in the future. And we finally have a moment to pull our heads up out of the water and look forward into the future. And there are many great things that have come out of this pandemic, including the relationships we started to build with all of you. We want to augment those and have many new leaders across our department that we can work with to bring these lessons and move us forward as a state. So it's my pleasure to introduce to you Dr. Rohan Radhakrishna. He is our Deputy Director of Office of Health Equity, who just recently joined us and will be leading our equity work for the department moving forward. And he can speak to how we hope to build upon CVAC community relationships, community engagement, and how we're going to work forward with equity for COVID and other public health issues. Dr. Radhakrishna?
Thank you so much, Erica. My name is Rohan, and I stand for love, dignity, and transformation. What I want to share with you all today is, as a newest member of this team for the past 10 weeks, I'm serving as the Deputy Director for the Office of Health Equity and also as the Tribal Liaison for CDPH. I'll take 5 minutes to share some priorities, updates, and next steps. The California for All agenda is really an equity agenda. And today, meeting number 15 of the CVAC, we're not at the end, we're actually at the beginning of an all society and all government focus on equity. Our CDPH director, Dr. Tomas Aragon, this afternoon at his Senate confirmation hearing, did name that equity and anti-racism is one of his major priorities. My office, the Office of Health Equity, will be supporting the directorate in normalizing, organizing, and operationalizing equity and anti-racism. The impact of structural racism and historic disinvestment in some communities has set the stage for these inequities that we saw in all too painful detail during the pandemic. The Office of Health Equity works on upstream policy systems and environmental changes. We work on embedding health in all policies, climate change, which invariably will lead to the migration of vectors and people and cause future pandemics, behavioral health, gender health, and racial health equity. But we've also helped staff the COVID equity work stream at the state level. We funded some COVID equity pilot projects in impacted communities and co-designed the equity playbook that's highlighted many of your innovations and best practices. We're committed to continuing this partnership to promote an equitable response and recovery. And to that end, I'd like to briefly mention, with the assistance of some federal funding, that our office will be creating a new branch this fall focused on advancing community equity. Some of the work will be internal to build a state equity plan to support state equity liaisons in 8 other centers across the department, to develop tools that will benefit all 200 plus programs at the state health department. But equity is all of our work, not just the work of our office. And so we'll also have 2 teams to focus on an equitable response and recovery going forward. One team will focus specifically on COVID vaccine equity, and the second team will support COVID health equity technical assistance. That means regional specialists, resource specialists, population subject matter experts, for example, for people experiencing homelessness. And the team will provide this type of TA, as well as create learning communities of collaboratives across the state and broadly support both local health jurisdictions and CBOs through contracts and grants. I want to share that we do have an Office of Health Equity Advisory Committee that has open public meetings. I'm putting in the chat now the link to that, and please join us. You're invited. We will have a meeting later this summer, and there will be 4 openings on the advisory committee, as well as rolling openings as people term out. Brace yourselves, as you know, this isn't the final mile. We now have to deal with the behavioral health impacts of the pandemic, the excess morbidity and mortality from non-COVID causes, overdoses, substance use, violence, cardiovascular death. There is much work ahead. Never waste the pandemic. May it be an accelerant of change for us to innovate and collectively address the underlying structural issues driving racial and socioeconomic inequity. So in summary, to quote Hamilton, this is not a moment, it's a movement. This past year working together was not an equity moment, it's been the building of a movement, and we look forward to continuing partnering with you. Thanks, Erica.
Thank you so much, Dr. Radhakrishnan. I think that was a perfect summary and hopefully speaks to what we've heard from all of you in terms of the importance of continuing this work and really leading us forward in that. And we look forward to partnering with you to do that work. I'd like to just briefly, because I was remiss earlier in thanking our teams, specifically call out, in addition to the Office of the Surgeon General and the California Department of Public Health, the California Department of Aging, our Department of Developmental Disabilities, Department of Social Services, California Health and Human Services Agency, the Governor's Office, and all of our partners across government, the state operations, and all of our partners across government, and as well as Secretary Richardson at GovOps. Thank you to all of you for making this such an excellent forum, and for all of your hard work and what we've been able to accomplish together. As we heard from Dr. Radhakrishnan, this is not the end, but the beginning of the next phase, and we look forward to your partnership as we move into that phase. So thanks to you all. Have a great afternoon and evening.
Yes, thank you all so much. We're humbled, and it's not goodbye, but until we meet again. So thank you all so much.
Thanks.
Thanks, everyone.
Thank you.